awesome. Thank you. Thank you so much for inviting me. I was super excited when Victoria reached out and said she wanted me to talk to this graduating class around starting a career in public health and sharing a bit about my experience, which was very exciting. So first of all, I want to say congratulations to everyone for getting to this point. I remember this day, the culminating conference was the most nervous thing I've ever probably done so far. So, you're almost there. So just hold on, you're getting there. So I wanted to actually keep the part where I speak a little bit short because I do want to answer questions. I know we all have questions when we're graduating and trying to figure out what's next for us. I'm sure with this class, it's even more heightened with COVID and everything going on and trying to sort out where you fit in the realm of public health. So I thought it would be a good idea for me to just talk about how I've learned to embrace the depth of a public health career beyond having the title just be public health. So I'm going to get into that a bit. So I'll start actually talking about when I graduated from this program, the Masters of Public Health. And as Victoria mentioned, I was working in public health in a project coordinator capacity while I was doing my Masters of Public Health. But I'll be speaking about what's sort of happened after that. So a bit of a funny story, I actually submitted my culminating report the morning that I actually got married. So I had to plan my wedding time around when the report was due, so I had enough time to get it done. And so once I actually submitted that, I ended up actually going on a vacation and really didn't want to think about a career and doing all that work. But once I actually settled down after a few months and really want to look at, what do I actually want to do with my Masters of Public Health? What does it mean to have a career in public health? And where do I actually fit? Who am I truly and what do I want for my career? And what I actually did was I spent several months researching the world of public health, really understanding how public health is structured across Canada, understanding how the health authorities are structured across BC. And I did that because I had been looking for a job with only a title that said public health or population and public health. And what I didn't want to do was limit myself. And I also noticed that there wasn't a whole lot of jobs with population and public health titled as the role. So I knew that I needed to look for something else. And what I did, as Victoria mentioned, LinkedIn, is I went on LinkedIn and I looked up everybody that had any sort of title with any of the health authorities or the BC government. There's also directories, and actually this is maybe something, some advice you could all do. There are a ton of directories around all health authorities, the BC government, the federal government, a lot of industries that work in the realm of the health and social system that you can actually connect with. And I did that. So I went and I connected with consultants, with all levels of public health, and really understood how the entire system works and where I think I could fit in. And that is a really, really key tip for all of you here as you're starting your careers, is to really understand the breadth of the health and social system here in Canada, and really taking a moment to connect with yourself to see, where do I actually fit in this system? What's, important to me? What feels really natural for me and where I think my interests lie? And going out and actually meeting with people. And just before I tell you actually the roles that I did, I'll just share that networking or connecting with people that are in public health careers and asking them to talk about themselves and how they got there is actually a very unique thing. So a lot of us that work in public health, and I'm sure a lot of your professors here can speak about it, we hardly, other than when we're interviewing for a job, but we hardly ever get an opportunity to actually speak about how we got to the position that we did, or why we chose public health, or why we've chosen this line of work. And so when people ask about it, how did you actually start a public health career? How did you decide this was the area you wanted to work in? It's a very unique ask. Not a lot of people ask, and people in general love to talk about themselves, and they're very passionate. So they want to share how they decided this was the work for them. So don't be shy about reaching out to people and asking their experiences. So once I did this research and I was really looking at where I wanted to fit in, there was a job posting that I saw within the Provincial Health Services Authority around risk management. And you might think, how is risk management related to public health? It seems that it's, moving so far away from public health formally. However, what I learned was that role was an integrated risk management program. So we're looking proactively across the entire BC health authorities and assessing risks so that we can prevent them. We can prevent risks and we can promote health outcomes. And that role really is when I realized how broad public health can actually be applied. And this particular program that you're about to graduate from is great in understanding how to work within the health system and bringing in that public health perspective. And so when I took on that role, it was incredible. I really got to learn how I could apply these skills in much different ways than just within a role that's titled Population and Public Health. So I'm only sharing that to just enlighten you all and let you know that don't let the titles of jobs prevent you from applying or not applying, but just really look into the role and see where can you actually bring in that lenses that you've been taught and that you have and that you want to bring into your work. And there is a lot of experience and there's a lot of opportunities out there that actually do need a public health perspective. And if we just, and Kathy just shared this, if we actually think about the COVID pandemic right now, public health is at the forefront. You know, we are taking a risk mitigation lens by adding these restrictions and these precautions and these measures to help our medical model and our health system actually be able to manage and survive. And so public health has been propelled into the forefront, and there's a lot of value that is being seen within the public health world right now. And so this is a great opportunity and a great time for you to really explore a career in public health and within the health and social systems. And so once I did the risk management program, I really loved it, but I did want to have a bit of a change, and I wanted something a little bit more in the realm of communicable disease and harm reduction, which was an area I realized was a passion of mine through the risk work. And so I followed that thought and that passion, and I ended up taking on a role as a policy analyst with the population and public health team at Fraser Health, which was incredible. And so the policy analyst role was really about getting deep into how things work within population and public health and the kind of systems and impacts that you can actually have and advisory notes that you can actually provide to executives and to leadership to let them know how we can move forward. And so I think that was an incredible role for me at the time, and I think is a great role for anyone just starting out in public health as well, because it really gets you to get deep into the system and really understanding how the systems work. And now what I'm actually doing, and now what I've moved on to after going on maternity leave and moving forward, is I actually now am a project leader responding to the overdose crisis and vulnerable populations programs within the Fraser Health Authority. So I'm one of two project leaders, and we are working in a very small team, but a mighty team of people that are trying to respond to the overdose crisis in Fraser Health. And so you'll notice that as I'm mentioning these different careers that I've had, they've brought in from risk management to working in the systems in a very focused role within communicable disease and harm reduction, and now going a little bit broader again, responding to the overdose crisis across the entire region. So what I'll share with you is that, and I'll share this in the next couple of slides, is that you really need to connect deeply with yourself to really understand where you fit in within the realm of public health. And within the public health system. And you'll realize that there's actually a lot of opportunities and there's a lot of ways you can actually apply the knowledge and the skills and the experience that you have and bringing that public health perspective, which is so important right now. So I'll just, my slides are a little delayed. So I'll talk about where I'm at now. So now I have, I'm working in a public health program within a leadership team, doing something that I absolutely love and that I'm passionate about. And really, I do feel is aligned with my purpose in life. And as Victoria mentioned, I do also host a podcast now called How Did You Learn to Do That? And it's really about people sharing their stories of how they've really connected with themselves and followed through to their passions and their dreams and really following the path to fulfillment within their lives and within their careers. And I have a lot of people sharing great ideas, great tips, and great stories. I also am a private consultant in the population and public health space. And Consulting is one of the areas that I know when I was coming out of school, I thought about it a little bit, but I didn't really know about a whole lot about it. But it's actually a really great way for you to work on some projects that you may not get to work on in a regular full-time job. And it really helps you pursue some passionate projects. It really helps you broaden your knowledge and your skill set. So I would consider consulting as a great opportunity for anyone that's interested. And then recently in the last year, I was, when COVID happened last year, I had a couple people reach out to me about starting careers in public health. And what I decided was I was informally mentoring and coaching a lot of students coming out of master's programs or undergraduate programs in public health and within the health system and the health world. And I realized that I should just formalize that and reach as many people as I can. So I've been coaching new graduates, early career professionals over the last year to really help them not only understand who they are and find what aligns with them, but also helping them figure out how to get into the system, how to be proactive in their application process and actually applying and securing those roles. But not only that, but how to actually navigate challenging situations within the work, how to position themselves strategically for that next opportunity, and how to actually just have a bit of a plan in where they see themselves and in their careers. And also, if they wanted to make a complete shift from two different careers and how they could actually do that as well. And so over the last several years, in the last 10 years of my career and in coaching students and really getting to know folks and my colleagues, there's three main things that I've realized in a lot of folks. One is that who you actually are is your most unique tool in your career. So as you're starting your career and as you're navigating your career and starting that, or I know some of you have already been in the public health space and have your careers, but maybe looking to get into new opportunities. So as you're doing that work, just know that you are your most unique tool in your career. There's nobody else here that has the level of experience that you have, the kind of experience that you have, or have experienced it the way that you have. So you are the most unique person. And just know that and know that value that you bring and that perspective that you bring that really no one else can. The second one is that having a bit of a plan, and I'm not talking about a rigid plan, but just a loose plan about where you want to see your career go, where you want to go in life, what's most important to you, what are your non-negotiables, as I call it. It's really important, and it's very critical when you talk about success in your career. And when I talk about success, I actually think about fulfillment. So having fulfillment in your career and in your life, I feel is one of the best ways you can actually measure success. And the third one is investing in yourself has the highest return on investment ever. And you know that because you've invested in this Masters of Public Health program in yourself. And, it doesn't stop once you graduate. It's really important that you continue to invest in yourself. You expand your knowledge. You continue to engage in what's most important to you and continue to learn. And I think that's really important in your career as you move forward. And so I just wanted to share, just before I wrap up, these 4 key common mistakes that I actually see in a lot of folks that are just graduating, that are starting their careers, or that have already had careers for 10 or plus years. And I actually just had a lady reach out to me who's reaching retirement, but really wanted to transition into a different world that she's always been passionate about, but thought wasn't for her. And we went through these 4 mistakes and we realized that she was actually making these as well. And I helped her move past these and work towards not having these mistakes. And now she's on her way to doing what she absolutely loves. So I want to share with you as you're just about to start your careers. So the first one I touched on a bit throughout, I'm talking about myself and what I've learned, so that a lot of folks are actually really unclear on who they are and what they actually want in a career. And when I'm talking about what you want in a career, it's not just the broad aspect of it, but just the minutia, the details of what it is you want in a career. What's most important to you? What are some things that you absolutely love? And what are some things that you know is challenging for you and you don't want to be doing long term? And having that clarity is really important to prevent you from feeling overwhelmed or feeling burnt out by doing too much of the stuff that you don't want to be doing. And so it's really important that you actually take some time to connect with yourself and ask yourself, who are you? What do you actually want to do? What you love and don't love? And that takes me to the second point here around self-reflection. I know I totally did this. I mentioned I got married the same day as I submitted my culminating report, but many of us, when we graduate, we, sell our textbooks. I mean, if you still have textbooks to sell, I don't know if that's still a thing now, but you get rid of your notes, you kind of have a fresh slate, and you don't really reflect on what's happened over the last 2 years or the last 4 years if you're doing an undergrad. And it's really important that you actually take the time to reflect on that, because that's a great experiment in looking at yourself as a person and where you fit in the spectrum of your career. What felt completely natural, where you're motivated to do the reading, you're motivated to do the work and the assignments, and it just felt natural to you and it came easily to you. And what did you actually find challenging? What felt like it was going against the grain? You actually had to find the motivation to get it done. And those are some key ways you can actually find out, where you actually fit in the system of public health or the health and social system, and figuring out where you want to invest your time and energy in terms of your career, or where you might want to do some additional learnings to learn a bit more about that area. So I really encourage you all to take some time to reflect once you are done the culminating report, to just see what happened and how you actually feel. And the third one is moving ahead without a strategy, which I already spoke about. It's really important that we have a bit of a guideline, a plan, and a direction of where we want to go in our career and in our lives. It really helps us stay on course and not feel like we need to do too much and feeling burnt out. And burnout is a real serious issue that I've noticed with a lot of folks, where we're just doing way too much at the same time, without it all kind of being along the same guidance or the same line of work that we find passionate or that we said we wanted to do. So having a strategy is really important. And the fourth one, which is actually my absolutely most favorite transformation that I see in my clients, is that you actually don't understand how truly awesome you are and how much you have to offer this world and how much to actually value yourself and what your worth is. And it's really important that you understand that. I know we all have some limiting beliefs. We have some negative self-talk, or we might feel a bit of imposter syndrome when we're looking for opportunities. I know when Victoria reached out to me saying I would be the keynote, I was feeling imposter syndrome, because I know when I was doing the culminating conference, it was a medical health officer, and I felt the imposter syndrome, and kind of like, who am I to be here to do this keynote? But working through that, because you actually don't understand how awesome you really are, and you have a lot to offer this world, and you have a lot to offer the public health system and the health and social sector. And you just need to know that, and know that you have a lot to offer, and you know your worth, and really go after it. Don't be scared to go after those big dreams and those big ideas. So just before we get to questions, I wanted to offer some resources. So on my website, I'm just waiting for the slide to change. There you go. So on my website, I do have a workbook that's free. You can go to howdidyoulearntodothat.com to download it. It does have that self-reflection about your course worksheet in there. So, setting a timer for yourself, taking a few minutes to really understand the pros and the cons of what you liked and what you didn't like, and the way you actually how you actually felt about not just the program, but the assignments, the readings, the work that you're doing, the topics, really understanding what fit best for you and what kind of was a challenge. And then I do have another workbook here that I love. It's called the Brain Dump. And in the Brain Dump, and I do this every Monday because I love it, is when you have so many ideas in your head, you just set a timer for yourself and you write it all down. And you really look at to see, what ideas or what things you need to do are important. What can wait, and, things that can just be eliminated because they're not that important. So having some time to actually do that is really helpful in helping to prioritize your time and your energy and what you're actually doing. I also have a course that I just created in November for new graduates and early career professionals, but really the learnings can be for anyone. It is a do-it-yourself, self-guided course just to help you understand how to navigate starting a career, or how to navigate networking, or how to set yourself up for what's next in life. And in addition to this, I do offer one-on-one coaching and bi-weekly masterminds with this. So if you're interested, you can reach out to me and let me know, and I can send you more information. And so the way you can connect with me really is through my email, and I'll share my email in just a moment. Like I mentioned, I do have the podcast. If you want it, if you're interested to listen to that, it is on YouTube and all major podcast platforms. I also have all my social media accounts here, so you can connect with me there. And then we're at the question. So that's my email right there, info@howdidyoullearntodothat.com. So you can always reach out to me to ask me any questions. I'm happy to provide any guidance or answer anything that you have. But I'm excited to open it up for questions to see what kind of questions you have regarding your career, your connection with yourself, and really just navigating this world.